On Monday, Dr. Camille Nelson Cotton did something almost unheard of for a career scientist. She quit her seat on the CDC's Advisory Committee on Immunization Practices, or ACIP, and did it in public. Her parting words were blunt. Americans are going to die because of this. Why would a transplant infectious disease specialist from Harvard walk away from one of the most influential vaccine panels in the world? She says the committee is being stripped of the very expertise it needs to keep the country safe. Here's the backstory. CIP is the 15-member group that reviews mountains of data, clinical trials, safety reports, hospital trends, and then tells doctors which shots every American should or shouldn't get. Usually, the roster changes slowly. 2 or 3 members rotate off each year, so institutional memory stays intact. But last month, the new administration of President Robert F. Kennedy Jr. took a dramatic wrecking ball to that tradition. 6 veteran members, including longtime chair Dr. Sarah Long, were told their terms would not be renewed. No scientific misconduct, no conflicts of interest, just a blanket dismissal. The move was celebrated by vaccine-skeptical activists who have long argued, without evidence, that the committee is captured by Big Pharma. For Cotton, the firings crossed a grave red line. "We're swapping decades of experience for ideology," she told colleagues. "When recommendations get politicized, vaccination rates drop. When rates drop, outbreaks happen." She points to measles. In 2000, the disease was declared eliminated in the U.S. This year, cases have already topped 150, mostly in under-vaccinated communities. Supporters of the purge say fresh voices are overdue. A Kennedy spokesperson argued that new members will focus on investigating vaccine injuries and restoring transparency. The administration has not yet named replacements or explained how they will be chosen. Inside public health circles, the reaction has been swift. The American Academy of Pediatrics called the dismissals a direct threat to children. The Infectious Diseases Society of America warned of irreparable damage to public trust. Even some Republicans who have clashed with CDC in the past say the shakeup looks reckless. Why does this obscure committee matter so much? Because its advice is the gold standard. Pediatricians follow ACIP schedules almost verbatim. Medicare and Medicaid reimburse based on its recommendations. Employers and schools often write its guidance into policy. Undermine ACIP, experts say, and the entire vaccine ecosystem wobbles. The stakes are not hypothetical. Flu kills roughly 30,000 Americans in a mild year. COVID-19 is still taking 1,000 lives a week. A single percentage point dip in coverage can translate into thousands of additional deaths. Cotton's resignation doesn't dissolve the committee, but it leaves one more chair empty, while the winter respiratory virus season is already underway. Former members say it takes years to master ACIP's torrent of data. You can't just parachute in a novice and expect them to know which trial was underpowered or which signal is noise, said Dr. Grace Lee, another ousted member. What happens next? The C.D.C. technically controls ACIP appointments, but customarily follows White House guidance. If Kennedy fills the vacancies with skeptics, the panel could stall or even reverse recommendations on childhood shots, boosters, or new mRNA technologies. States would then have to choose between federal advice and their own health departments, a recipe for confusion. For now, Cotton is back at Massachusetts General Hospital treating immunocompromised patients. She says she'll keep sending evidence to whoever will listen, but from the outside, "I couldn't lend my name to a committee that isn't free to follow the science," she said. "The public needs to know that." Whether her warning rings true will become clear the next time a virus looks for the weakest link and finds it.